So the next speaker is Wendy Lawson, and she's going to speak to us about another exciting area of practice, point-of-care ultrasound in hemophilia, building a strong foundation for clinical implementation. So Wendy is the Associate Dean of Medical Radiation Sciences and Allied Health at the Mohawk McMaster Institute for Applied Health Sciences, and holds a faculty appointment as lecturer adjunct for the Department of Pediatric Medicine at McMaster University. Wendy is an expert in curriculum design and competency assessment, developing sonography programming for ultrasound technologists, radiology residents, and point-of-care practitioners in a number of specialty areas. Her principal research areas include best practices in the implementation of point-of-care ultrasound, development of curriculum benchmarks and core competencies for point-of-care, and recommendations for the use of point-of-care ultrasound in the management of hemophilia. Wendy has presented internationally on musculoskeletal ultrasound topics and advocates for the appropriate use of point-of-care ultrasound in the hemophilia community of practice. Wendy has served on a number of boards and committees as chair of Sonography Canada and the Canadian Medical Association's Committee on Program Accreditation. Wendy has received a number of awards and recognitions, including the Mohawk College Award of Excellence, the College Sector Educators Award from the Society of Teaching and Learning in Higher Education, and the Award of Fellowship from Sonography Canada. So welcome, Wendy.
Thank you so much. Good afternoon. I'd like to start off today by thanking, of course, the Rendez-vous Symposium Organizing Committee for inviting me to speak with you today, particularly David Page for extending the personal invitation. I am profoundly excited to be here to speak with you and to work with this community of practice. As you heard from my bio, my background is not in hemophilia care and management, but rather in the traditional pathways of diagnostic imaging, particularly ultrasound, as well as in education, competency assessment, and quality assurance in care. And I think that it is amazing and inspiring that this community has embraced that perspective in their effort to implement point-of-care ultrasound into practice. I was invited here to speak about point-of-care ultrasound, and I think you've probably heard or read enough about the topic to know that it can't be done justice in 15 minutes. So I have focused my presentation today really on looking at building a strong foundation, building an infrastructure that will support quality in the integration of point-of-care ultrasound into frontline practice. There is an amazing amount of great work being done globally in this space and through many, many different lenses, all of which are incredibly valuable. There are people looking at building protocols and the validation of protocols. There are people looking at ultrasound and how we can push the envelope in the research vein on what ultrasound can do and tell us about hemophilia as a disease. And then our research, which is very much focused on getting point-of-care ultrasound into practice, into the front lines where it is going to have an impact on patient care. So these are my disclosures. I'd like to acknowledge and thank Pfizer for their ongoing support of our research. We've really been amazed by the entire community, sponsorships, the outreach of the physicians, of the physiotherapists, of the nurse practitioners that work on the healthcare team, and how the dedication and devotion to quality in this community of practice is second to none. So it is a pleasure to work with you. Our objectives today really are to review the strengths, weaknesses, opportunities, and threats of point-of-care ultrasound implementation into hemophilia practice, to look at how we overcome obstacles in clinical implementation by way of awareness, education, and quality assurance infrastructure, to discuss collaboration with community and industry partners to enable evidence-based research in the areas of point-of-care ultrasound training and the impact on patient outcomes, and to introduce the Mohawk College Imaging Research Center with a focus on point-of-care ultrasound research and training. I'd like to acknowledge and to thank my entire team. We have been working collaboratively, Mohawk College with McMaster University, with Hamilton Health Sciences, and with Providence Healthcare. Our research team is bringing all of the expertise to the table. So a multidisciplinary research team across multiple centers and multiple educational institutions to try to build on everyone's expertise and to develop the real strength of infrastructure that is needed to integrate point-of-care ultrasound effectively. We've been working on this project for a number of years, and this research team has representation from a physiotherapy group, hematologist group, radiologist, from educators, researchers, and students. So it's quite a diverse portfolio. I think that the best place to start when you want to have a discussion about point-of-care ultrasound and what it can do and whether or not you should invest the time and the resources to really explore it is as simple as a SWOT analysis, an exercise looking at the strengths, the intrinsic strengths and weaknesses of ultrasound as a technology, as a modality, against the opportunities within the community of practice and the threats. This gives us an opportunity to understand the tool, to make informed decisions about how to move forward, and to build a roadmap that will enable us to turn those threats into opportunities and understand the limitations of the tool. So when we look at ultrasound as a modality, we are talking about something that is quite appealing to a point-of-care user, not only in hemophilia care and management, but a number of other disciplines as well. Largely because the technology is available, it's fast, it's portable, it's high resolution with the ability to demonstrate fluid, soft tissue, as well as osteochondral changes. It's important to recognize that ultrasound as an imaging modality has limitations as well. They do not create barriers, but they help us to understand what the goals of an ultrasound examination can be and what is reasonable to expect from the modality. So some of the weaknesses that ultrasound has is limitations in terms of visualizing intra-articular structures. It is highly user-dependent, which creates an environment where there is risk of lack of competence, requires regular use and ongoing professional development. Like everything else that we do, like every other skill set that we use in our day-to-day work, we have to maintain our competence, we have to engage in lifelong learning, and we have to keep up with the technologies that we are using. Some of the opportunities that exist, these are the ones that are most profound. These are the reasons that I'm standing here today. Ultrasound has been shown, it has been accepted to have the potential to improve patient outcomes, to improve the patient experience, to impact clinical decision-making, and we were working to build a database to really identify what the real impacts are on patient outcomes. But with all of this capacity, with all of this opportunity, this is a reason to invest. This is a reason to study. This is a reason to spend time, to explore the technology, to take the time to build an infrastructure to support it, and to see what we can do with it. The threats: inappropriate use, barriers to implementation, lack of formal training, and a lack of opportunities for maintenance of competence, a lack of data on what it takes to maintain competence, and a lack of professional development opportunities to build your skill set. So how do we take that SWOT and turn it into a roadmap to success? Well, we have to overcome some obstacles. Two primary buckets in terms of where we need to go. We need to recognize the importance of training and competency evaluation. We need to build an infrastructure that supports validated training in the field, assesses competencies, and builds an infrastructure and a framework of quality and quality assurance. And we have to understand the goals of point-of-care ultrasound. We have to look at what is appropriate use and how we can consult with other areas and other departments to ensure that our use is appropriate, to ensure that we are using with quality, and to ensure that our outcomes are the best that they can be. Some of this is defining what point-of-care ultrasound is and using a common language. Some of it is understanding protocol development and the validation of protocols. And some of it is working with diagnostic imaging to collaboratively use both point-of-care ultrasound and traditional DI pathways to come up with the best answers for our patients. So defining point-of-care ultrasound is really about understanding the difference between point-of-care and traditional diagnostic imaging. There is a real lack of understanding in the point of care space across multiple disciplines around goals. Really, point of care ultrasound is not as simple as being ultrasound used by a non-traditional provider of care. Some people define it as anyone doing ultrasound that's not a radiologist or a sonographer, but this is in fact not the case. Point of care ultrasound is very specifically defined, particularly in Canada, as an examination performed by the primary healthcare provider in adjunct to a clinical examination to provide additional detail and to validate findings. It is incredibly specific. Protocols that are built to explore point of care purposes really are very niche. They're specialized and they identify typically the presence or the absence of a finding that you already expect to be there. The easiest way to explain this is to say if someone came into a clinic with pain and you didn't know why there was pain and you had no suspicion of why there was pain, it wouldn't be a point of care ultrasound to explore that joint and look for the reason for pain. As compared to if based on a clinical exam you feel there is an acute hemarthrosis, you want to use ultrasound to see if you are correct, to validate that finding, that is identifying the presence or absence of a suspected finding. And this is really the overriding intent of point of care. It is also intended to be time-saving when diagnosis and treatment is critical to patient care, and also in situations where you can inform your decision by using ultrasound to provide additional information in addition to your clinical exam in a situation where that patient is not likely to go through diagnostic imaging pathways anyway, and you would have made a decision without it. So what is appropriate use? This is probably my biggest point of advocacy in the use of point of care ultrasound is how do you use it appropriately? And it's really about understanding what it is, understanding how it's defined, working with radiology to develop protocols that are appropriate and fall within the appropriate use of point of care in terms of its definition, understanding your scope of practice, not looking at your scope of practice as a barrier, but rather looking at this as an opportunity to find pathways that will help us to build an infrastructure that allows us to adapt the system to meet our patients' needs. I am a firm believer of innovation in healthcare, and I don't believe that our healthcare system should be the ones driving what we do. I think that we should be building an infrastructure that allows our system to adapt so that we can always be moving forward to improve our patients' care and to build on patient-focused care. And I think that point of care ultrasound has the capacity to do that. We need to ensure that we are practicing with knowledge, skills, and judgment. We need to participate in consultative practice and incorporate evidence-based quality assurance frameworks. So what's interesting is the hemophilia community of practice has expressed a real interest globally in point of care ultrasound and the potential benefits to patient care and patient outcomes. And the very way that you have gone about doing it in this particular community of practice, dedicated to building a strong infrastructure, building a strong foundation, looking at quality, has really created a unique environment in this space where there is very little controversy and a lot of interest in collaborating with this community to make it happen. The potential is there, the capacity to change patient treatment is there, and really we're seeing a lot of players come to the table in an effort to help. I'm very pleased to announce for the first time that Mohawk College, in collaboration with McMaster University, Pfizer, and other industry partners, has just this week launched the Mohawk College Imaging Research Center. And this is a live site. The URL is on the screen there. I've captured some screenshots to walk you a little bit through some of what we're doing in the Imaging Research Center. But the entire goal of this center at this time is to help build an infrastructure that will support the implementation of point-of-care ultrasound into hemophilia care. And really, it has a focus on training, a focus on data collection, competency assessment, and ongoing quality management that has really created a roadmap that can make this work. So in combination with all of our partners, we are launching registration for point-of-care ultrasound courses Registration will open this summer, and courses will likely start running in the early part of the fall in an effort to build the necessary skill set to do the studying and the research that needs to be done to collect data on patient outcomes. One of the things that we have to remember is that we can't collect good data on a technology that's being used by individuals who may not have been trained or feel comfortable or competent to use it. The training has to come first. And so in collaboration with global partners and work that's being done worldwide in protocol development, we are trying to start by building the foundation that will support this in the long run. So we're offering a full suite of point-of-care ultrasound courses for the management and care of hemophilia A and B, all the way from management of acute hemarthrosis and synovitis to acute muscle bleeds, chronic and complex patients, with a number of different audiences in mind. People who are interested in incorporating point-of-care ultrasound into their practice and utilizing it on a day-to-day basis, being the providers of point-of-care ultrasound, but also people of the healthcare team who may not want to use ultrasound, but may just want to understand its applications, the language, the terminology, and how to talk to patients about it. I'm running short on time, so I'm not going to navigate you through all of the site, but would encourage you to go to the site and take a look. There are some contact us type options where you can leave your name and email address if you would like to receive additional information about course registration. Generally, our programs are online and hands-on in terms of building on both knowledge-based and hands-on training. So it's a full spectrum of opportunities with different types of learning environments. I just want to sort of finish with the idea that you will succeed if you are building on a strong foundation. And that means a strong foundation in implementation, and it means really building from the ground up. When you're an innovator, when you are blazing trails, like point-of-care ultrasound is doing, you don't have the benefit of being able to look at other people's best practices and have policies and processes that you can draw from. You have to create them. So we're in that space right now. I would encourage anyone who is interested in point of care to work closely with DI, to engage in lifelong learning, to be a part of the bigger research projects going on in terms of tracking outcomes and maintenance of competence, so that we can really build this into the fibers of everything you do. Point-of-care ultrasound is supported by industry. Companies with high-fidelity ultrasound training simulators have approached us asking if they can help. Can they build high-fidelity training simulation platforms to assist in the training in this space? And we can see that the impact on society is tremendous. We are looking at patient outcomes locally. We're looking at a sustainable healthcare system, decreased wait lists and referrals for DI. We're looking at the ability to service remote communities, and we're looking at an absolutely profound possibility in terms of global impact. So I would like to thank everyone for your time. I would like to tell you that we will continue to make a focus of knowledge transfer. We're not just going to do the work, we're going to share the work. So there will be ongoing presentations, global outreach, publications, and tracking that is accessible to everyone so everyone can stay informed. Thank you so much for your time.